Welcome back to Rochester in Focus. You know, at this time of year, winter, a big fear for many people is getting sick. But there is comfort in knowing that there will be doctors and nurses to help care for you if you do get sick. Today, we are talking with Dr. Bridgette Wiefling, who is the Senior Vice President of Rochester Regional's Primary Care Institute. And about $1 million grant is coming to help address the growing demand for nurses in our area. So we invited Dr. Wiefling here. How badly is the Rochester region understaffed when it comes to nurses?
You know, it's a problem New York statewide, and what we know is they're projecting a 6% increase in need for nursing over the next 3 years, and statewide a 20% increase in need. We currently have roughly 74 positions that are open in the LPN field specifically, and several more in the RN space.
And are you just talking about the Rochester Regional Health System, 74 positions?
Yes.
Yeah.
Yes.
And so I'm sure the other health systems.
It's a growing demand. It is a growing demand all over
and that's because
the region.
An aging population?
You know, it's interesting. Nursing is the foundation for healthcare, and we're learning how to help everybody to work to the scope of their license. And as physicians become much more in shortage, more work and more scope is required of our nursing teams.
Yeah.
And we're also developing new technologies and moving out into population health management. And nurses are a foundational component of our population health management strategy, and so we need them in order to help all of our families, friends, patients to be able to be healthy, to really understand their disease and understand how to best manage themselves so they can live their best life.
Right, so nursing is the first step.
It is.
For many people, it's to become a licensed practical nurse. And let's talk about how Rochester Regional Health has developed a school, the Isabella Graham School of Nursing, just to train and address this issue. But first, who's Isabella Graham?
So Isabella Graham Hart is a volunteer. She had been a volunteer at Rochester General Hospital for a number of years, along with her family. She was a benefactor to the hospital when she died in 1898. Her husband and family donated the school to the hospital, and it was developed from there as a Isabella Graham Hart licensed practical nursing school.
Wasn't that great? And I understand you've been able to graduate about 60 students every year, and now because of the grant we mentioned, you can double that. And so you're expanding, and let's show everybody. Some people might remember the Everest Institute. It closed down, but you're going to be using that facility to expand, so you can do 120 graduates?
We will have 120 graduates, and we're expanding the experience of our nursing students to also include our new pavilion, the Rochester Fans Critical Care Pavilion.
Oh, very good. And tell us about the feeder program. You already have this going, the School to Work program that kind of helps high school students understand more about the nursing field and whether they might want to go on for further training.
Exactly. So we identify students who are interested in being in the medical profession, and we introduce them into nursing. We're also partnering with Hillside Work Scholars as part of this school to help create that pipeline of bright young minds that want to be in nursing and give them the support that they need. We are providing through this opportunity with the Economic Development Council and our MAPI, which is our poverty initiative in the region. We are developing this pipeline to support students to ensure that they're successful by hiring life skills coaches, as well as keep mentoring to help them. Maybe nursing doesn't end up being what they want to do for a lifetime, but we want to help them at least get through the LPN degree and then keep them engaged in the healthcare field going forward so they can be successful. We have some different programs that are wrapped up in the school that will help those students if they get into any kind of trouble, have questions, concerns, don't understand how to apply for further education or grants or things that might be available, or scholarships.
Right, because LPN, you start with that, and we have some pictures of them being trained, but often they go on to become registered nurses, and that takes a little more training. Can they do that all at the school?
They can.
Oh, that's great. And so with this grant from the Finger Lakes Regional Economic Development Council, it's a real commitment to helping people be trained and get jobs and then stay within the Rochester region.
Right, and to stay in their community.
And so what do you think we can expand even beyond 120 now, or are we kind of at capacity?
Right now we're focused on the doubling of the capacity to 120, and we will follow that over time and see if there's the ability to expand it further. What we do know is through our partnerships with the other schools and colleges in the community for registered nursing programs, that we would be working very hard with those schools and colleges in order to drive the desire and the success of these students into further nursing and allied health positions.
Yeah, that makes sense. It's a collaborative effort here. And if somebody's watching today, what should they do? You know, is there a semester that's starting up in the new year, or do you do year-round school?
Yep. So we have a fall semester fall semester and a spring semester, and they should contact either on our website, or they can actually call the Isabella Graham Hart School of Licensed Practical Nursing and get information.
Wouldn't you know, we linked up that website to our website at WHEC.com, so you can find out more about Isabella Graham School of Nursing through Rochester Regional Health, through Rochester in Focus. It's all there at weblinks at WHEC.com. But Dr. Bridgette Wiefling, thank you so much for sharing your information, because I think a lot of people might be interested in this and will hopefully further their careers.